Good afternoon and welcome to the May 27th Community Update. My name is Stacy Wood and I serve as a Public Information Officer here in the Emergency Operations Center. We are offering these COVID-19 community updates to the public to ensure that everyone has access to accurate information. This community update is also available in Spanish on the Buncombe County Health and Human Services Facebook page, and that can be found on Facebook at BCHHS. Today's updates will come from Dr. Jennifer Mullendore, Interim Public Health Director and Medical Director for Buncombe County, Dr. William Hathaway, Chief Medical Officer for Mission Health, Calvin Hill, Chief District Court Judge, Alan Thornburg, Senior Resident Superior Court Judge, and Buncombe County District Attorney Todd Williams. And we will get started with Dr. Mullendore.
Good afternoon. As of noon today, there have been 279 lab-confirmed cases of COVID-19 in Buncombe County residents. 119, or 43% of these cases, have occurred in residents or staff of long-term care facilities in our county. Sadly, 20 Buncombe County residents have died from COVID-19, including 15 residents of long-term care facilities. A majority of these deaths have been in individuals over the age of 65. At this time, there remain 4 outbreaks of COVID-19 in long-term care facilities in Buncombe County. Our communicable disease nurses are in daily communications with these facilities, making sure that they have the resources they need. And we are grateful for the role that these facilities and their staff play in caring for our friends and family members with respect and dignity. During outbreaks, our guidance and what these facilities have been doing is frequent testing of all residents and staff. And we have seen that some long-term care facilities in our county who have not yet identified any cases of COVID-19 have begun to test their asymptomatic residents and staff. We must all remember that we're all connected, and that while many of these cases and many of these deaths are occurring in long-term care facilities, these facilities are not islands. The staff and administrators of these facilities live in your community, in your neighborhood. They shop at the same stores that you do. And so we have to remember that we all share the same space, and that it's important that we all play a role in protecting each and every member of our community, especially those who are most vulnerable to illness and death. Since COVID-19 is primarily spread through droplets, face coverings are recommended for all of us to use. Cloth face coverings are primarily designed to protect others from viral transmission. In other words, you're not wearing it so much for yourself as you're wearing it for that other person that you may come into contact with. And we have to remember that wearing a face covering is not a replacement for practicing the social, physical distancing from others and good personal hygiene practices like hand washing. When performed together, these actions can help prevent the spread of COVID-19 in our community. Each and every one of us has a role in protecting our community against this global pandemic, and I encourage you to take it seriously. To date, almost 7,000 tests have been performed on Buncombe County residents, and over 200 people have been tested through the community testing sites. COVID-19 symptoms continue to expand, and they now include fever, chills, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, sore throat, loss of taste or smell, congestion or runny nose, nausea, vomiting, or diarrhea. In our community and throughout all the testing done so far, many people who end up testing positive for COVID-19 commonly have had very mild symptoms. Older individuals and those with underlying medical conditions, like diabetes, asthma, or heart disease, are more at risk for becoming severely ill with COVID-19. And we ask that if you think that you might have COVID-19, that you please get tested. Call your primary care provider or call one of the facilities listed on our website where testing is available, such as Range Urgent Care, the 4 Mercy Urgent Care locations in the county, Mayheck Family Health Center at Biltmore, and Mission My Care Now at Biltmore Park. Community testing continues today at Sandy Mush, tomorrow, May 28th at the Deaverview Community, next Tuesday, June 2nd at Klondike Apartments, June 3rd at Pisgah View Apartments, and June 4th in the Big Ivy, Barnardsville community. At this time, the sites are open from 1 to 4 p.m. on their designated days, and there is no out-of-pocket cost for individuals to be seen and tested at those sites. Language services are available as well. We also ask that people take advantage of the self-checker found at buncombeready.org to assess your symptoms and your need to get tested. I'll now turn it over to Dr. Hathaway.
Good afternoon, and it's a pleasure again to be here in front of you. I'd first like to thank the community for their continued efforts to flatten the curve. I think we've been predominantly successful in that endeavor to date, but would also like to remind us that the work is not done, and throughout my comments today, you'll hear me reinforce the need for attention to the 3 W's, as we'll see. At Mission Health System today, we have 8 people in-house who are infected with COVID-19. This is a number that is slightly higher than our prior 2 to 6 average, and I think reflects a real increase in the prevalence of the disease in our community. We had peaked at 12 people hospitalized with COVID-19 last week, and this was related in predominance to what Dr. Mullendore referred to as a cluster of cases in our skilled nursing facilities. Interestingly, the patients that were hospitalized were the staff members of these facilities and not the residents. And I think that's a credit and a tribute to the hard work that the staff members do in caring for these patients in what can only be described as exceptionally challenging and difficult times. And I would like to echo Dr. Mullendore's comments that we remember the hard work that they're doing that is both physically and especially emotionally demanding at this time, both on the employees of these facilities and of the family members of these patients who are suffering. We continue to monitor our supplies closely right now. Despite the increase in the number of cases, we do not feel that it puts us at risk for our ability to care for the community, both for COVID and for non-COVID illness. We have ample rooms for care of patients. We have ample supplies to care for the patients, including ventilators and personal protective equipment. I want to reassure everybody that we're monitoring that on a daily basis to make sure that we have no problems with supplies as we move forward. I want to give an update about some news that I think has become public knowledge recently about a cluster of cases that has occurred in staff members at Mission Hospital. We became aware of this past Friday when a small number of staff, all of whom work together on a specific unit in the hospital, one of our pulmonary floors, came down with symptoms of COVID-19. Those staff members were tested, and in the testing process, we identified 6 members of our staff who were actually positive for this illness. Immediately, we went into our contact tracing mode, both of staff members and of patients, to determine if there was any risk to anyone else in the units. We found that there was no evidence of risk to patients, that all contacts with patients occurred in fully protected gear. We determined that it was necessary to test the remainder of our staff on that unit, and at this point in time, we have identified no additional cases. A total of 48 people have been tested to date and have been negative, with 7 additional test results currently pending. Now, I want to emphasize that this exposure took place about 10 days ago, and so we feel that we're near the end of the window where this will be putting additional staff members at risk, but we're continuing to watch for the development of symptoms in anyone at the hospital. Again, I want to reemphasize that we do not believe that this has put any patients at risk. All staff members were fully in protective gear when interacting with the patients. We're going to continue to restrict visitation for the time being. We're going to continue to follow our universal masking policy, and we're going to continue to cohort our COVID-positive patients and those who are suspected of having COVID-19 illness. And I want to emphasize that this cluster of cases occurred in some of our most dedicated and talented staff who have put themselves on the front line of this illness and who take pride and privilege in caring for these patients. They are among the most skilled with respect to their knowledge of isolation techniques and of their use of personal protective equipment. And I think that this should serve as a reminder to all of us of the nature of this illness, how highly transmissible it is, how infectious the agent is, and that if this can occur to these heroic people in our own facility, that it could occur to any of us at any time. And I want to emphasize that we should be ever mindful of the 3 Ws as we're moving into phase 2, well into phase 2 of the uplifting of our social restrictions, and that those 3 Ws again are wear a mask, wait 6 feet apart, and wash your hands. And that's the tip of the iceberg. Only go out when you need to. Be mindful of your neighbors. Be respectful of your neighbors. Wearing a mask is a sign of ultimate respect to those in the community. And again, if this can happen to people in our community who are the most skilled in using personal protective equipment, I think it's a warning to all of us. And the last comment that I'd like to make is that the hospital remains a safe place to get your care. We want to reemphasize, as I said last week, that we've seen a decline in the number of people who are seeking emergency care in a variety of conditions, and we don't want anyone to be apprehensive about coming to the hospital for care that would otherwise warrant attention, such as stroke care, heart attack care, or other severe life-threatening illness. And the same goes true for your doctor's offices. That is a safe place to get care. We want people to seek attention when they have medical problems and not avoid it for fear of getting the virus. The risk of that is exceptionally small compared to the risk of not seeking medical attention. Thank you very much.
Good afternoon. Our courts are beginning to expand operations consistent with the Chief Justice's order. beginning on June 1st. I say expanding operations because our courts, as many of you know, have remained open and operational during this period. While we have operated with greatly reduced numbers, we have still managed to carry on the business of the courts. Many of the matters we postponed, including landlord-tenant matters, will now begin to come back online at a gradual pace, unless we hear differently from the Chief Justice or the Governor. We have worked with courthouse leadership and the county to begin planning a safe re-entry into the courts, consistent with Chief Justice Beasley's orders and Governor Cooper's orders and our local commissioners. We will be moving forward with wearing masks, social distancing, hand washing or sanitizing, and the necessary cleaning protocols. The county has provided personnel to go into each of our courtrooms and calculate the number of people we can safely have in each one. Additionally, they have advised us with regards to CDC recommended guidelines for usage of these spaces. This process is still ongoing and will undoubtedly require some tweaking as we begin to see citizens come back into the courts. Our courts will continue to utilize the remote technologies for processing cases in the courts, again consistent with Chief Justice Beasley's orders. For those cases that require court appearances, we will be strongly recommending the usage of masks or appropriate face coverings while conducting business inside the courts. This will provide added protection to courthouse personnel and for other citizens who are inside the courts and offices. We likely have a substantial backlog from the weeks of reduced calendaring of cases. We will be reviewing the pending cases and prioritizing them according to seriousness, age, and readiness to make the most of our time each day. We will be asking for your patience as we move through this uncharted space in our court's history. We will get to all of your matters as expediently as this situation and all the issues that come with it allow us. Thank you, and we look forward to having you back in the courts and taking care of your matters.
Thank you, Judge Hill. I want to mention briefly also on the topic of the Chief Justice's order, which was updated last Thursday. She reiterates that we must continue to provide justice through our courts, but also ensure the safety of the public and our employees. It's a balancing act, and I hope that you as the public will understand that. According to the Chief Justice's order, we will continue to suspend jury trials at least through the month of July. And so at this point, we will begin jury trials again no sooner than the 1st of August, which means that if anyone has been summoned for jury duty, you will not be required to serve during the month of June or during the month of July. Otherwise, you should check with the clerk to make sure when you must serve. That does not include members of our grand jury. Our grand jury did meet last month, and it will meet again this month and next month, and will continue into the future. So that does not apply to the grand jury. The Chief Justice has also requested that that I, as your senior resident Superior Court judge, appoint a COVID-19 coordinator to be the point person with the Administrative Office of the Courts. Mark Schimberg, our trial court administrator, has been named to be our COVID-19 coordinator. And Mr. Schimberg, along with myself and Judge Hill, District Attorney Todd Williams, Leanne Melton, our public defender, and our assistant county manager and the director of our Justice Resource Center, and our clerk of court, Steve Cogburn, we will all be meeting to determine how best to add capacity to our court system as in-court proceedings begin to happen on a broader basis and with increased frequency. A few items that we will be specifically ensuring are accomplished are the marking of all public areas where the public is required to wait. There will be markings on the floor. All the courtrooms will be marked for appropriate social distancing to make sure that there is at least 6 feet between any member of in the general seating area, 6 feet in any direction. The maximum capacity of each courtroom consistent with that social distancing will be clearly posted. And again, we ask that the public be patient with us and understand that this is a balancing act. We don't anticipate there being significant issues with regard to that. The courts are considered a critical government function, so technically they don't come under the executive order requiring the minimum numbers to the maximum numbers together. However, I would tell you that all of us at the courthouse will make sure that anything we do in terms of numbers in public spaces will comport with current public health guidelines, and those markings will make sure that that is done. In addition, there will be hand sanitizer at the entrances and exits to all the facilities and to each of the courtrooms individually, and also to any high-touch areas. Also, all public areas of the courthouse will be cleaned daily. We want to thank the county for their help with that, and high-traffic areas will be cleaned more frequently than that. In addition, each session of court will ensure that that public health guidelines are adhered to and that individuals not be required to wait any longer than necessary. We will be establishing time slots for individuals on our calendars to make sure that there's no unnecessary congregating, and individuals and their attorneys will show up at the appointed time. So that has proven very beneficial and efficient. I think District Attorney Williams will go over with you the calendars. If you are on the court calendar, you will be expected to appear with our expanded courts in operation beginning June 1st. However, if anyone has symptoms of COVID-19 or has a fever, and I believe that's 100.4, I'll ask our health professionals, or if you have any other concerns, if you're at a particular high risk and you have concerns, you will be, leniency will be freely given. However, you must check with your attorney, and if you're a pro se individual, you must check with the district attorney to make sure that you are excused. Otherwise, it will be necessary that you show up according to the calendar. And if you have any questions about where you are on the court calendar, you can go to nccourts.gov and go to Buncombe County, and you will see if you are currently on a calendar. Finally, beginning June 1st, pleadings and other documents delivered by the mail will be deemed timely filed if they are received within 5 business days of the filing deadline, and that is an expansion of previous extensions that has been given by the Chief Justice as well. And finally, we will be evaluating how we might begin to have jury trials in person beginning in August. And as Judge Hill told you with regard to District Court and Superior Court, that will be done with close collaboration with our public health agencies and with stakeholders in the courthouse to make sure that jury trials are done safely. And that would mean that jury pools are handled in a safe manner and that a seated jury would be able to carry out their duties while attending to their public safety. And that is ongoing, and we will have further updates for you with regard to that. So that concludes my remarks. I would just say that if you have any further questions, you should go to nccourts.gov. There is extensive updates on COVID-19 issues and how our courts are working, and there are a number of deadlines that have been extended and alterations in our normal proceedings of court that may be of interest to individuals. So I encourage you to visit that site if you have further questions.
Good afternoon. I want to thank Buncombe County for the opportunity to communicate with the public about how we're going to move forward with expanded operations on the criminal side. And I also want to thank the judges and acknowledge their comments. Chief Justice Beasley's recent order signals the beginning of the restoration of more normal courthouse operations. And I want to take this opportunity to summarize where we're going and where we have been since the emergency shutdown or reduced operations of our courts were ordered March 13th. Since then, the District Attorney's Office worked with partners in the Sheriff's Office and the Judiciary to reduce our jail population by up to 40% in the hope that we would reduce the chance of any COVID-19 outbreak in Buncombe detention. We also continued hundreds of court dates well into the summer to reduce foot traffic and prevent the spread of COVID-19 within the public facility that is the courthouse. And the District Attorney's Office also dismissed thousands of minor traffic tickets and other matters for similar reasons. As we move toward reopening or expanded operations next week, I want to provide a summary of what the DA's office plans in regard to expanded operations. Again, this is just limited to criminal. Some of the judges commented on civil matters, but as to criminal expanded operations, in district court, the District Attorney's Office will prioritize domestic violence, driving while impaired, and Class A1 misdemeanor offenses for prosecution. If you are charged with any of these crimes, it's the District Attorney's Office's position that you must come to court. If you fail to come to court, the District Attorney's Office will ask our judges to issue orders for your arrest. Class A1 misdemeanors generally include the following offenses: assault on a female, sexual battery, assault with a deadly weapon, assault inflicting serious injury, assault by pointing a gun, assault on a child under the age of 12, misdemeanor child abuse, assault on a governmental official, secret peeping, stalking, death by motor vehicle, and violation of a domestic violence protective order. If you're charged with any of those crimes, inclusive of DWI and any other domestic violence matter, you must come to court. If you are charged with a felony that pens in Superior Court, on a Superior Court calendar, you must come to court unless your attorney has instructed you otherwise. If you're charged with any other crime charged within the judicial system, contact your lawyer for information about your court date. If you are charged with a non-Class A1 misdemeanor or felony that is currently pending in district court as opposed to Superior Court, the DA's office, together with the courts, plan to use social distancing technology and procedures whenever possible to resolve these cases without your physical presence, without the physical presence of the defendant in court. In short, if you have a lawyer, talk to your lawyer to determine whether or not your attendance is needed in court. That is, again, just to restate, assuming you're not charged with DWI or a Class A1 misdemeanor or a felony. If you received a June or July administrative court date for a traffic matter such as a speeding ticket, registration offense, or another misdemeanor, your case has been rescheduled. Go to buncomeda.org to look up your new court date. The DA's office soon plans to add new services to buncomeda.org. If you don't know your court date, have a question about your case, and you don't have a lawyer, you will soon be able to submit a question through the website. If you do not have access to the internet and do not have a lawyer, you may call the DA's office at 828-259-3410 for assistance. The DA's office appreciates that these are extraordinary times, but our work advocating for public safety and victims' rights must continue while we also strive to do justice and ensure procedural fairness, case by case. Thank you.
Okay, well, that concludes today's updates. Please be kind to each other, and please continue to share accurate information about COVID-19. The next community update will be on Monday at 2:30 p.m., and we will see you then. Thank you.